Sophie Nabukenya, a clothes designer who graduated in development studies last year, is epileptic.
I learned that I have epilepsy when I was in P5, but my mom told me I also first got my first seizure when I was a baby.
Due to the complications of the disease, Nabukenya says life in primary school was difficult.
I would find myself alone, like I have no friends. I would end up sitting alone, and that's when they would come up with those stories. They say that I sit alone and my eyes become green.
Things got a bit bearable when she was put on medication.
Yeah, it got better. I could get them once in a while, not like as frequently as I would get them.
Today, Nabukenya was part of those who commemorated the International Epilepsy Day at the Ministry of Health headquarters in Kampala. Professor Angelina Kakoza, a child neurologist with Makerere University, explained what causes epilepsy.
We now call it a disease of the brain, whereby the brain has been damaged to an extent that it causes abnormal electrical discharge. This abnormal electrical discharge causes the patient to manifest in a different way.
Professor Kakoza also explained how epilepsy patients should be handled in the event of an attack.
Make sure that the area around where the patient is has been removed of all the clutter. If there are tables around, if there are chairs around, please remove all of these so that the patient can be free. Don't try to put, wherever some people put garlic, they put maybe spoons or forks, trying to prevent the person from, the teeth biting the tongue. Please don't put anything in the mouth because you may do more harm than good.
When it comes to medication, epilepsy requires lifelong treatment.
We look at carbamazepine, we look at phenytoin, we look at phenobarbital, we look at folic acid. And of course, we also use epilim.
But it has been revealed this morning that the country is experiencing a shortage of epilepsy medication.
We are aware of the shortage of medicine in this country, especially medicine for non-communicable diseases, not only for epilepsy. Epilepsy is one of the non-communicable diseases.
Having epilepsy, drugs are your daily meal. Once you go off the drugs, you have issues. You have adherence issues. You will have seizures upon seizures.
Members of Parliament have offered to support the Health Ministry to deal with the stockout.
We are actually drafting a bill that we can present on the floor of Parliament. It's a process, but as I know the Speaker, the Deputy Speaker, who is so willing to help us fight this disease that is on, will hear us and allow us to present this motion on the floor of Parliament.
Joyce Nakato, NTV Tonight.